Hi, I'm Brian Cimelli, Chief Operating Officer for the Massachusetts Competitive Partnership. We're a nonprofit, nonpartisan public policy group comprised of CEOs from some of Massachusetts' largest multinational-based companies. I'm here with Laurance Stuntz, the Director of the Massachusetts eHealth Institute, and we're here today to talk about an exciting public-private partnership, a new public-private partnership in Massachusetts around digital healthcare. Digital healthcare is a broad area encompassing everything from telemedicine and electronic health medical records to big data applications around life sciences, issue areas such as genomic sequencing. And this is an initiative that the private sector, the public sector, and the academic arena has been focused on here in Massachusetts. And I'm going to turn it over to Laurance in a moment, but we did some due diligence and analysis up front. The digital healthcare sector over the next decade or so, the market opportunity is at about $32 billion. And it's an area where Massachusetts has assets that we want to leverage in life sciences, in tech, in healthcare certainly. So Laurance, why don't you tell us a little bit about this new exciting public-private partnership in Massachusetts and what it's all about?
Sure, thank you, Brian. So I'm Laurance Stuntz. I'm the director of the Massachusetts eHealth Institute at the Mass Tech Collaborative, which is an economic development agency that's been around for about 30 years. MIHI's role is specifically focused on healthcare technology adoption, as well as on economic development in this area. So this is, as you mentioned, a huge market opportunity for Massachusetts. Massachusetts already has more than 250 companies in digital health headquartered in the state, as well as numerous other large companies with a significant presence in the state. So as part of our discovery effort around how to help grow this sector, because while it's big, obviously there's potential to grow it to be even much bigger. We spent a lot of time over the past year talking with stakeholders in the sector about what do they need and what can the state do. What's the appropriate role for a state agency to work on. So three main things came up. One is cluster convening. How can we, and are there ways that we can bring together companies as well as their customers as well as academic institutions to bring them all together. So we're calling that cluster convening. One major key initiative out of that, and I'd like to thank the competitive partnership for your support in helping get this off the ground as well, is the Pulse at Mass Challenge space.
Right, fantastic, great announcement, yeah.
Yeah, so we announced it last week. The state is investing to help support the organization and both Mass Challenge in Boston as well as Tech Spring in Western Mass to bring together an area and a physical space in the Longwood medical area where companies can meet each other, where they can meet potential customers, and where we can support the further growth of late-stage digital health companies. So that's the first key initiative. The second key initiative is what we're calling the Digital Health Marketplace Program. When we talk to entrepreneurs, one of the things that they express as a key issue is how do we get our products to market and into real clinical settings much more quickly and get them validated by our customers. So the Marketplace Program is going to bring those organizations, both customers as well as new and startup companies together. And then the third key issue is around healthcare data. Opening up both public data sets as well as giving systematic access to private data sets to entrepreneurs. We really think there's a huge impact both on the economic climate in the state, as well as we think that all these smart ideas can help have a real impact on overall healthcare cost and quality in the state. So, I mean, that's the state area, which is only a piece of this. This is really truly a public-private partnership, and I'll turn this back around and ask you to talk a little bit about the private sector involvement in this and where you see this going.
Thanks, Laurance. And I think that's key. I think that point is key, and we really want to hone in on that for Massachusetts. This is a public-private partnership, and it's so important to clarify that because in Massachusetts we do things a little bit differently, and we engage everybody and coalesce everybody around the table and do our due diligence to identify the impediments to company growth and formation in various sectors, and digital health is one of them. So Massachusetts Competitive Partnership's happy to be a partner in this. And on the private side, we're happy to announce today, and we've announced last week back in Massachusetts, but to announce out here at BIO in San Francisco, a $25 million private equity fund that will be solely investing in digital healthcare companies in Massachusetts, willing to locate to Massachusetts, or who have a significant presence in Massachusetts.
That's great news.
And that's an area where the private sector feels that we can complement some of the great initiatives that the state's doing. And that obviously saves some cost for the state if you have the private sector filling in on that piece of it. And one other area that I wanted to touch upon that we're proud of in the private sector, and we tell people it's not the most exciting area, but I think for the audience here at BIO, it is an exciting thing, is the standardization of tech transfer agreements within the digital healthcare space. We had a working group that we put together with Harvard, MIT, Partners Healthcare, which is the parent company for Massachusetts General Hospital and Brigham and Women's Hospital in Boston, and a number of other stakeholders and constituents who came together and agreed on these standardized tech transfer agreements, which we think are going to be hugely impactful as we continue to commercialize products and make it easier for entrepreneurs and even faculty within the higher education system to go ahead and commercialize innovations and start new companies. So really just taking that holistic approach, and we're happy to be a big partner about that.
That's great, and actually wanted to mention to folks who may be watching that those agreements are hosted at massdigitalhealth.org, which is the convening website that we've got for the cluster. So there's a directory of every digital health company that we know about in the state. More than 250 of them, more than 350 organizations are partnering together in Massachusetts on this effort, and we're really excited about it.
Yeah, that's great. That's great. And I just want to reiterate that we're very excited that the governor of the Commonwealth, Charlie Baker, is taking an interest in the lead and appointed your agency, the eHealth Institute, to be the entity who administers this initiative on behalf of the governor's office, and also Mayor Walsh and the city of Boston, who have been really great partners in this initiative as well. I think it's important that we have everybody involved. So it's great that you're hosting that your entity is in charge of it, that you have those standardized agreements on your website. And is that the place where people can learn more about this digital health initiative and how to get involved?
Yeah, so if massdigitalhealth.org/sign up, and they can get involved. They can register their company if they're not in our directory, and they can get access to our newsletter and connect with us there.
Excellent.
Well, thank you very much, Brian.
Thank you, Laurance, as always. And here you have it. And you can go to the eHealth Institute website that Laurance just mentioned to learn more about the initiative. And that's it. Great.
Thank you very much.